So welcome everyone. It's an absolute pleasure to be hosting this webinar tonight. It's a great delight to be able to introduce Dr. Gemma Newman, who really doesn't need any introduction. And I was just thinking on my way home how long it is that we've known each other. We met at the first Plant-Based Health Professionals conference in March 2018, and our paths have been sort of intertwined ever since. So my name is Dr. Shireen Kassam. I'm founder of Plant-Based Health Professionals, and Gemma has been with me on this journey ever since we started. So I will say a few words in a minute about Gemma, but before we get going, obviously the excitement this week is that Gemma has launched her book, The Plant Power Doctor, which I couldn't recommend enough. It is everything you need to know, and a real sort of practical guide to getting back your health using a plant-based diet. And as always, want to share, thank you our sponsors. We have CPD accreditation from the British Society of Lifestyle Medicine. Our Zoom platform is as courtesy of veganfitness.com, and we have funding from ProVeg International. And a reminder of our next webinar, which I think will be very topical. The lead author of the EPIC Oxford study and their most recent paper was about bone health and vegans, and I think it will be well worth tuning in, so get your questions ready to ask about this topic. And a reminder that we're still in Veganuary, and we have our 21-day plant-based health challenge created by Dr. Layla Dagan, our education lead at Plant-Based Health Professionals. So, as I say, it's a delight to be able to introduce Dr. Gemma Newman. She has been a doctor in the NHS for the last 17 years, and she really does practice holistic medicine, using every tool available to her to help her patients be the best that they can and live the healthiest lives that they can. And clearly a key component of that is a whole food plant-based diet. But of course, there's much more to that than just nutrition. And Gemma is going to share with us her experience of using a whole person approach to medicine and healing from her own practice, and hopefully we'll all come away with some great tips on how to improve our own clinical practice. So welcome, Gemma, and thank you.
Thank you, Shireen. That was a lovely introduction. I hope you're all feeling well this afternoon or evening. It's actually the evening already. Perfect, wonderful. So yes, as I said, there's a bit of a cheesy photograph. That the photo of me on the right, that was one of the photos they took during the photo shoot for the book, and I thought it quite summarises how much I love plants. As you can see, I look very pleased about plants there. And this presentation is all about how you can achieve results for a healthier plant-powered life. And as Shireen said, it's not just about the nutrition, but I will be sharing lots of nutritional information and studies, as well as things that I've been doing in my practice along the way. Do feel free to ask questions as I'm talking. I think Shireen's going to field those questions at the end, but I'd love to see you getting engaged and making comments and questions as we go along. She's given me a lovely introduction, so I won't go on too much about who I am. Suffice to say that I am senior partner at an NHS clinic. I've got nearly 3,000 patients. And I do have specialist interests in obstetrics and gynecology, family planning and lifestyle medicine, and of course plant-based nutrition. You would have seen me at various courses and events in person until the pandemic. Now hopefully you will be able to hear me sometimes on podcasts and on courses like this, which you can look up online. I've got a family, I've got 2 sons, and we recently got a pet dog as well, which has brought a lot of joy to our lives during the lockdown. Conflicts of interest, Shireen mentioned my book, but also I get paid various honoraria for online courses and medical education events from time to time. I do have a paid ambassadorial role with Phinova and Tonic Health, and I also received sponsorship from Superdrug for an online summit that I did over the summer months. So, going back to the learning objectives of today's talk, you already know them hopefully from having signed up, but one of the main things I really want you to take home today is the tools that you can not only use for your patients, but also for yourself. I would love for you to feel empowered to make some changes to your own life as a result of this presentation. And they don't have to be big changes, and it may be that you're already really healthy, but I'm hoping that some of these tips and the advice that I give will be relevant for you and your relationships, perhaps with family members, loved ones, as well as your work colleagues and patients. So I will be discussing my personal framework for helping people to achieve behaviour change, and you can learn some simple motivational interviewing techniques that will also help you along the way. And let's face it, it has been an incredibly challenging time. It was always going to be tough to be a healthcare professional. I'm a GP, and I certainly see every day in my patients a lot of challenging problems. And in years gone by, I would have been sitting there often with my head in my hands, not really knowing exactly how to help my patients, because they would come in, they would have a variety of chronic problems, lifestyle related problems, societal related problems that I just couldn't solve and would never be able to solve. And it felt quite exhausting. And I'm sure that many people who are hopefully listening tonight may have felt the same. And for me, it took lifestyle medicine and specifically plant-based nutrition to help me understand how powerful my patients could actually be in helping themselves to feel better. Having said that, of course, this year has been really tough. And I'd also like to caveat this presentation by saying that on the backdrop of COVID-19 and our current pandemic situation, it will be harder to help your patients with behaviour change because they're going through so much and it's an ever-changing situation. But it is still possible. And that's why I think it's even more important now, more than ever, to learn the tools that we're going to talk about today. Because there are simple things that you can do to help them, even when it feels harder, even when you're on the phone a lot more than in person perhaps. There are definitely ways that this information will still apply. And to me, I'd like to describe it as a sort of a domino effect. And it's a funny thing, you don't think that what you're saying in a consultation or even with family and friends is going to make much difference, but it could be the right message at the right time for them. So, take the case of a man who's in his 60s, he decides to eat more fruits and veg. He finds his mood improves and his fitness levels improve, so he decides to get a dog. Many people have, especially in lockdown. And then he goes to the park each day, and when he does, he meets a lovely lady, and they meet up socially distanced, have a chat, keep walking the dogs. It becomes a routine. They enjoy each other's company so much that they decide that they're going to move in together and start a life together and live happily ever after. Now, I'm not saying that we're all going to meet the love of our lives because we ate more vegetables, but I am saying that there are endless possibilities for an improved life, all in the foundations potentially of a 5-minute chat. And that's the power that you have as a healthcare professional, because you can plant that seed that then goes on to things that you couldn't possibly imagine. And that's also why I'd like to share a patient video. Some of you may have seen this video if you were at the VegMed conference last year. For those of you who haven't seen it, I hope that you enjoy it. It's a short 4 or 5 minute video explaining some of the changes that some of my patients have seen during their time at the surgery and how it's benefited them.
The process actually started with my first meeting with my new doctor. She's a younger doctor. She's a new generation of doctors.
I lost my HGV license due to high blood pressure.
The problem was that I'd collapsed.
I thought that I was going to come in and sit with Dr. Newman, and she was going to say, there's nothing you can do about it, you're just going to have to live with it.
Sometime back, I was feeling very lethargic and depression sort of things.
I developed Crohn's disease, just wouldn't clear up, wouldn't stop.
I was diagnosed with polymyalgia rheumatica.
I had angina, had an angioplasty, arthritis, high blood pressure, high cholesterol. Then I got prostate cancer, and when I got that call to say that it was all clear, boy, yes! To suddenly have an option of giving up the medication, I took her advice. And it's like, for me, it's like being in a prison. and suddenly you're released. That's what it felt like. We need to get the message out there. We need people to know. There are older people suffering like I did, who had no idea that all they had to do was buy vegetables.
My motivation to switch was to do with how I was feeling, and assumed, because of my age, that it was kind of hormone based. She said something completely different, which actually made me think people that were plant-based were other people. It's given me my life back again.
Well, the doctor discovered was that I had a very high blood pressure on the day that I came, which was, I believe, to be 212. A few weeks later, it had gone down to about 140 odd to 150. The amazing thing I noticed, I felt a lot better, is improved my way of life, and instead of feeling coming up to 82 years of age, I feel like I'm 62.
She introduced me to a more plant-based diet within the first 3 days. I started feeling better within the first 3 days. When I came back after the 2 weeks, and my blood pressure count was so dramatically reduced, it was amazing. And then I could get back to work. I just felt elated. I never believed that a diet could make such a dramatic impact on your life.
The main things I've been struggling with and suffering with is Crohn's disease, primary sclerosing cholangitis, kidney disease and asthma. When I made the switch, the things that I noticed, I wasn't bloated anymore, and the marvellous thing was I wasn't running to the toilet anymore, which has been a nightmare, to be honest. Also, I felt much better in myself. I was breathing better. My tummy seemed much more calmer, you know, didn't have this awful pain all the time that I always experienced. The kidney specialist, as I say, was absolutely shocked when the readings were so good. And also the Crohn's specialist also has now said he doesn't need to see me. So I haven't been to see the Crohn's specialist now for nearly 2 years.
I'm feeling a lot healthier, happier, and very fit in life. I was taking blood pressure medicine and also the medicine for my diabetes. I need no more of these medicines. I'm doing without medicine. I'm on a good diet, and that diet has been the main element of making me back to a normal life.
And it got to the state that I couldn't get out of bed. And I was very, very distressed. And I was so upset because I care for my husband and I couldn't care for him. So it made me very sad. Dr. Newman actually gave me a diet. Actually, to eating these foods, everything of my body is working okay. And I find that all plant-based foods now help my joints, and I don't feel half as stiff as I used to. And so I've got a feeling that cutting out red meat and going to plant-based foods helps my polymyalgia rheumatica.
Well, you're never too old. You're never too old to change.
I would recommend everybody try a plant-based diet.
Well, it's given me my life back.
I would definitely recommend others.
It definitely works. Plant-based foods improve your life. It's as simple as that. Give it a go.
I want to say a huge thank you to my patients for letting me share their stories. And these are ordinary people, as you can see, but they are doing extraordinary things. And I would love for you guys to see your patients doing extraordinary things as well in their lives. So yes, I just want to really emphasize that anything can be possible. It's never too late, as one of my patients said, John, in the video above, once you've taken that first step. And so now I would love to share a simple framework, a motivational template that I have created to help you help your patients to do this. So it's called Blend It, okay, and Blend It is the acronym, and Blend It stands for believe, listen, evoke, no bossing, desire, information and timed. So try to remember that as we go along, because I will reference back to it as we go through the talk. Believe, listen, evoke, no bossing, desire, information and timed. Blend it. So we're going to start with B, which is blend it. Believe in blend it. And belief is really important. The reason that belief is important is because we expect our patients to undergo quite a lot of difficult things. We make them undergo uncomfortable examinations, investigations, blood tests, surgical procedures. And in order for them to let us do these things, they have to have confidence that we know what we're doing, and we have to have confidence that it's going to work for them. And it's also important because what you're doing is you're building a therapeutic relationship. You have to believe that they are capable of change. We've all had those heart-sink patients that we feel as though we can't help. But in order to really create change in people's lives, it's really important to have a belief that they can do it, because it affects our interaction with them. In fact, there was a study to show that the relationship that you build with your patient at the beginning of the consultation, and this can be in pretty much any context, it does infuse the consultation with a meaning response, which one study I read showed was actually more powerful than the placebo response. So it's definitely something to consider, that your relationship with that person, it doesn't have to be long-standing, it could just be created within moments when you first meet them, is really important for helping build rapport. Now, the other thing that you have to believe is that the intervention that you're suggesting really works. And that's why I'm going to spend a fair amount of time during this talk now going through some of the places where you can find information to show that it works, but also to share some of the information with you so that you can feel confident that what you're suggesting is powerful. So first bit of information here, I do really respect the work of the nutritional epidemiologists out of Harvard. So if you want to know more about their work, you can click on that website. There's a great journal, the International Journal of Disease Reversal and Prevention. They've got lovely case studies in there as well. And I believe that Dr. Shireen Kassam and Dr. Alan Desmond have both shared case histories that have been in that journal. Then if you want to know more about plant-based approaches online that you can learn about, the T. Colin Campbell Centre for Nutrition Studies has an online course. And I really like the Plant-Based Diets in Medicine website, which has carefully collated various studies based on different specialties in medicine and how they relate to plant-based diets. We've also got here in the UK the University of Winchester Sustainable Nutrition course, which has been led by Dr. Shireen Kassam, who is also an associate professor at the university, as well as the culinary medicine course and the Physicians Committee, which is, again, that's across the pond in the US. Some great resources for patients and doctors alike. The True Health Initiative, which is founded by Dr. David Katz, who was incredible. He was talking last week, and he is a real powerhouse of nutritional knowledge. In fact, check out this book. This book was written by Dr. David Katz. And this is just an accumulation of some of the things that he wants to impart to people. So he is a real powerhouse of information on lifestyle medicine and nutrition. So do follow his work if you're interested. And we've got BANT, the British Association for Applied Nutrition and Nutritional Therapy. Now, there's also another lifestyle program that I'd love to draw your attention to. Some of you may know about it, and it's called CHIP. And CHIP stands for the Complete Health Improvement Programme. And what's great about it is that it was actually founded on 20 years of clinical research by Dr. Hans Diehl, one of the founding members of ACLM. And it's actually being used in the UK now as well, which is fantastic. It's a lifestyle modification programme. And in fact, I've got an awful lot of references at the end of the talk that you can also find on the CHIP website repository that show the specific benefits of a whole foods plant-based intervention in community-based lifestyle education programs across the world. And as I said, the great thing is it is being implemented here in the UK, and there's been funding for local GP surgeries to use this lifestyle programme as part of their disease prevention efforts. So if you want to know more, you can always contact the people who run CHIP in the UK. And in fact, the partner at my surgery is now beginning to lead the first group of patients that are going through this programme. So it's really exciting that these opportunities are coming up now. As Shireen mentioned, it's not all about food. I do want to just pay homage to the fact that movement is really important for reducing risk of things like cancer, heart disease, mood problems and beyond. If you want to know more about the specific benefits of exercise for lifestyle, then I would actually recommend the Primal Play website by Darryl Edwards, because he has collated a number of scientific studies on the benefits of exercise. He's a firm believer that movement is medicine. So if you want to have a look at that, please do. And I would also like to touch upon planetary health. It's a really important thing to all of us, I'm sure, but it's something that I think doctors haven't talked about very much, because our main remit is to help the patient sitting in front of us. But the modern day doctor, I believe, really needs to consider the health of the patient's children and their children's children and beyond. And the fact that we may not have a planet that's viable for human life if we continue using resources in the way that we are now. So if this is something that bothers you, please do look at some of the resources I'm talking about here, not only for your own study, but also to give you confidence to talk about these issues with other colleagues, with other healthcare professionals, so that they think that it makes sense, so that they can get on board. You've got the Lancet Commission report, which came out in 2019, I think it was, and also the BDA, the British Dietetic Association's One Blue Dot campaign, which is all about environmentally sustainable diets and shifting more towards plant-based patterns. And One Blue Dot refers to the appearance of planet Earth from space. And I think it's a really nice homage to the fact that we have to implement some real sort of big thinking when it comes to environmental changes, and that we have to consider more than just the individual sitting in front of us. Lastly, with regards to UK resources, it's really interesting to let you know, if you don't already, that the Royal College of GPs, the RCGP in the UK, has actually launched the Green Impact Scheme, where GPs who are practicing here can encourage their staff members and their patients to have a more plant-based diet as part of their efforts to become a green practice. So there we go, it's also being endorsed by the RCGP. And if you didn't catch it, the Lancet did a 2019 report, and it was called the Lancet Countdown on Climate Change. And when I read it, I was really struck by it, and I would love to share a small quote from it just to give you guys an understanding of why this is so important for our planetary health. I'll just read it out now. The life of every child born today will be profoundly affected by climate change, with populations around the world increasingly facing extremes of weather, food and water insecurity, changing patterns of infectious disease, how apt that they said that then, and a less certain future. Without accelerated intervention, this new era will come to define the health of people at every stage of their lives. A second path, which limits the global average temperature rise to well below 2 degrees Celsius, is possible and would transform the health of a child born today for the better throughout their lives. Placing health at the centre of the coming transition will yield enormous dividends for the public and the economy, with cleaner air, safer cities, and healthier diets. So I just really wanted to read you that section from that report, because this is real life-changing information. It is paradigm-shifting information, and hopefully it will give you the confidence to chat with friends, family, and colleagues about the changes that we all need to think about moving forwards. So now I'm going to focus a bit more on the individual studies that you might be interested in order to help you with the belief aspect of your BLENDIT acronym. For those of you who are GPs, many of you may not be aware, there was a great study done by GPs in New Zealand. It's called the Broad Study. And they got a series of 65 subjects, randomized them, and they were either overweight or obese. They usually had type 2 diabetes or heart disease or high blood pressure or high cholesterol. And it was a great lifestyle intervention study. They were able to show that without mandating regular movement and without mandating any form of caloric restriction, they were able to achieve fantastic weight loss targets and metabolic benefits for these patients that they had as part of this weight loss program. More than any other study to date that they had found in terms of free living participants, which I thought was just really exciting. And it definitely adds to the weight of the literature with regard to lifestyle change and modification. And it's not just things like diabetes and weight loss. Briefly want to touch on hormonal health. We could do a whole talk on hormone health, but for now, suffice to say that having a whole foods plant-based approach to eating really helps with SHBG levels, SHBG. the sex hormone binding globulin, as you know, is an important molecule because it attaches to estrogens and means that you don't use them if you don't need to. It releases them when you do need them. So when you have PCOS, you don't have as much of this special molecule that binds estrogen. Therefore, you are more susceptible to the effects of estrogen dominance and metabolic syndrome. So it's actually a really beneficial thing to have more whole plant foods. It helps with hormonal regulation, thereby improving things like period pains, PCOS, and even fibroids and endometriosis, which I cover more in my book, but suffice to say there is some study evidence to suggest that. I would love to see more. Why is it so useful? Well, I'll briefly touch on diabetes. I love this particular study, it's really interesting. It was a very long randomized controlled trial, and they compared the conventional diabetes diet with a low-fat vegan diet to see who had the better outcomes. And interestingly, it was the low-fat vegan participants that had the better outcomes for their blood sugar control and weight loss than those who were having the conventional diabetes diet. Why would that be? Well, it's to do with how our pancreases work and also insulin resistance. Again, we could do a whole talk on diabetes, but when you have a whole foods plant-based diet, what you're doing is you're improving beta cell function and you're reducing insulin resistance. So you're able to eat these high natural sugar foods like fruits, as well as the root vegetables, pulses, grains, herbs and spices, nuts and seeds, and you're not going to get that big sugar spike because you're able to use the insulin effectively. Again, it's not all about food. There are studies to show that moving your body is great for insulin sensitivity. So is removing stress from your life, and so is sleeping well. So it's just really great to be mindful of all the other pillars of health that there is evidence for with this particular chronic disease as well. Moving on to dementia. This is an interesting study. It showed that foods generally protective against dementia, specifically Alzheimer's dementia, were foods such as fruits and vegetables and grains, lower fat dairy products in this study population, legumes and fish, and foods that were associated with a much higher risk included meat, sweets and high fat dairy products. So again, it can be really useful for staving off the effects of dementia. I love this study. It was a cute little study to show that dancing in dementia patients was actually great for improving cognitive decline and also metabolic syndrome. So moving and having fun with movement is really important. Even when you can't necessarily remember the last time you did a dance, it's worth having a go. Arthritis, both you can see this study here on osteoarthritis, but also rheumatoid arthritis, can be improved using our diet. And there's a number of reasons for that, but it's thought that osteoarthritis, as well as rheumatoid and other inflammatory arthritises, have beneficial effects for symptom control based on the fact that what you're eating is generally very anti-inflammatory. So you have less microscopic inflammation going on within the joint. It would be remiss of me not to mention heart disease. Now, although there are many studies in epidemiology showing broad benefits to eating fruits, vegetables, the Mediterranean diet style, the Leon Heart study was great at showing how much natural foods, fruits and vegetables and things like that were good for heart disease. Most of us know the research of Dean Ornish and Cobalt Esselstyn. Interestingly, putting that into practical terms, the Undo It programme with Dr. Dean Ornish has actually been financed in Medicare in the US, and Dr. Cobalt Esselstyn also runs a practical programme for people in order to improve their heart health. And that's what I'm all about, I'm all about helping people to create change in their own lives. So I always get really excited when I see that there are practical programmes helping people with these lifestyle interventions. And I should have said from the previous slides, that also there is a great intervention for rheumatoid arthritis, which is the Paddison programme. Although I should caveat that by saying that it's not run by a doctor, but he does have various regular doctors, nutritionists and dietitians on to talk. So what about this side of the pond? Well, we have the Happy Pear Chefs. Again, they're not medical, but they have collaborated with medics to create online courses that people can do to help with lifestyle change. So they started off being inspired by the Dean Ornish programme, which I showed you on the previous slide. So they started their first course, the Happy Heart course, because of the inspiration that they got from that, which was tremendously successful. Then they moved on to create the Happy Gut course with Dr. Alan Desmond and dietitian Rosie Martin, who are also members of PBHB UK. as well as Dr. Sue Keneally, who has helped them to create a science-based weight management course. So, and oh yes, and I helped create the Happy Skin course with a well-known aesthetician in Ireland. So there is a lovely opportunity there for people who can't necessarily get the help that they need from their own doctor, or who can't necessarily afford to seek out private nutritional help, that they can potentially afford one of these online courses that may help them to improve their lives as well. And plant-based diets may also improve our lifespan. This study shows how plant-based intervention can actually help with telomere length. The telomeres are the caps on the end of our chromosomes, and when they are functioning well, then they can they basically help with cell division. So the more times your cell can divide is dictated by the amount of telomere that you've got left on the ends of your chromosomes. And once that's run out, then the cell dies. Well, the beauty of this lifestyle intervention program, which was done on male patients with low risk prostate cancer, was that they were able to have longer telomeres, less degradation of the cell, and therefore it had a longer life. So you're actually reversing aging on a cellular level. Now, don't get me wrong, we're all going to age, aren't we? And we're all going to die. We all die of something. But what I think is really inspiring is when we can live a long and healthy and happy life. Because you don't want to live a long time and not be able to enjoy it. And so I do love the examples of the blue zones. If you want to look up the research of Dan Buettner, he is a National Geographic journalist. He teamed up with the National Institutes of Health to research the blue zones. Some of you may know the blue zones. They're the 5 areas of the world with the highest healthy longevity, amount of people living to 100 or thereabouts. And yes, they all eat a predominantly plant-based diet, 100% plant-based in some cases, like the Loma Lindens in California. They have lots of fresh foods, they move naturally throughout the day, they've got strong family bonds, there is a focus on compassion, they have a focus on knowing your sense of worth and purpose, and putting your family and friends first. So these are really interesting trends that I think are really quite helpful for us to see, okay, well, what we're suggesting here can help. It's just a matter of now helping people to implement them. So getting back to my mnemonic, we have covered believe very extensively, but I think it's important because hopefully now I've engaged your academic brain. You feel as though you've seen evidence that it can be helpful. Now I'd like to perhaps engage your heart a little bit more, because we're going to be moving on with some of the other behavioural techniques that you'll find really helpful and hopefully quite interesting to help you with behaviour change. So we've done believe. Next up we have listen, or should I say look and listen. Now, it's really important, especially when you've got a face-to-face consultation, that you actually look at your patient as they're coming in and you give them a little bit of your attention so that they feel heard and listened to. Now, many of us learnt this in medical school, but sometimes it's quite easy to forget, especially as we've got to type everything on our computers and there's so much paperwork to fill in. But the beauty of looking at your patient, first up, you get to know a bit more about them, so you can see what they're wearing. You can find out if they smell of alcohol, you can look at how they're walking, you can look at their demeanour, how they're feeling. You can get a lot from just looking at them from walking in. But also, as I said before, it helps them feel understood. Studies show that the patient perception of how long you've spent with them is longer than the time you actually have spent with them if you are able to look and reflectively listen. Not only that, but the chances are that you'll actually get to the root problem as to why they're here more quickly, because they will feel more able to open up to you. So that's a really important one. And what about listening? So reflective listening is really important. And this is what I would say, you have to, it's kind of a technique to it. So the most important thing would be to say something along the lines of, how are you? So open-ended questions. And then when they give you their answer, you reflect it back to them so that they know that you've understood it. Again, it's part of creating that simple rapport to help them feel understood and for you to know that you've got everything that they need to tell you. So I'd like to give you a little bit of an example, which I'll move on to actually in a minute. The next thing, now where do we get to? E for evoke. So evoke is really, really important. you have to help your patients see a brighter future. And the reason that that's so important is that it's one of the main ways that you can actually help people motivate themselves towards change, because motivation doesn't last very long. So you need to be able to have them think, okay, well, I can do this today, I can do this tomorrow, I can do this next week, I can do this for the rest of my life, and I can feel good about it. And so asking them questions like, how will it feel when you can ... whatever it is that you're asking them to do. And also you can ask them things like, when you had this experience last time, what helped you to get over it? So then you're helping them to remember times that they had the resilience to use certain tools that helped them, and they can articulate that as well. And so evoking that positive future is really important. It empowers them because they can remember times that they helped themselves before, and they can imagine a brighter future, which is really, really important for this kind of exercise. No bossing. So that is the N in Blend It, no bossing. This is really important because it's one of the things that I think many of us struggle with, because as we have gone into medicine, what we want to do more than anything else is to help our patients get well. And it's really easy for us to then perhaps boss them about a little bit or think that we know best. But the problem with that is that it does meet resistance. And one of the most important pieces of advice I ever got in my medical training and for my life in general was to leave my ego outside of the consultation room and to let go of the outcome. So I can do my best to facilitate a patient with getting better, but the decision is theirs. And it allows them the real autonomy to decide to make a change. And it doesn't mean that you don't care. It just means that you're giving them that choice, you're giving them that decision, and you're not going to get too caught up on what happens next. It's also quite good for your mental health to let go of the outcome. And why is that important? Because if you're bossing them around, which many of us are prone to doing, and especially with children, actually, I have to say, but it is a natural human tendency to resist persuasion, isn't it? So, for example, what happens inside is that there is an internal dilemma. So when you're doing something that you know isn't healthy, half of you kind of knows that what you're doing isn't particularly healthy, and half of you wants to continue doing exactly the same thing because there are certain pleasures that you get from that behaviour. So if somebody articulates all of the reasons why they should change, then you're forcing them to defend their current position. It's just human nature. So say, for example, you said, did you know that plant-based diets are excellent for reversing type 2 diabetes? So what you should do is cut out meat and dairy and junk food and eat lots of fruits, vegetables, whole grains and legumes. They would probably say something like, yeah, okay, well that makes sense, but where am I going to get my protein from? And I couldn't eat that rabbit food, and nobody in the house would cook it or eat it, and I'm not a great cook. And so it gives them the chance then to come up with all the reasons why it wouldn't work. And the problem with that is that we tend to believe what we hear ourselves say. So you're basically forcing your patient to defend their current position and then consolidate that position so they're actually less likely to engage in behaviour change than before you spoke. This is important. So this is probably the most important parts of this presentation. Never tell them what to do. What is really helpful instead is reflecting resistance. Okay, so an example of that would be, say you had a patient in front of you and you wanted to talk to them about their alcohol consumption. You'd ask them an open question. You'd say something like, tell me about your drinking habits. And they might say, oh, well, I don't drink that much. You know, I just have, 3 or 4 pints at the pub every night after I get home from work. And in your head, you're thinking that is way too much. You are already over the national limit for safe alcohol consumption. But try to resist saying that and instead maybe say something like, what do you think about drinking that much? And then they have to come up with a thought on that. And they may say something like, well, I haven't really thought about it. And then they might say, well, actually, sometimes I'm feeling a bit groggy in the mornings, actually. And yeah, maybe I get this tummy pain every now and then. And so you're able to then pick that out and say, oh, so you're telling me that sometimes you feel quite groggy in the mornings. And tell me a bit more about this tummy pain that you're experiencing. And what it does is it draws out some of the problems that they themselves have found about the habit and consolidates the idea that they might want to change it. And it may be that they don't change it during that consultation, but they may be ready for change, and you are the person there hopefully to catch them in that moment to help them through transitioning. And one of the most useful phrases that I can teach you for that part of the consultation is simply asking them the open question, what have you noticed? Because if you ask them that question, it gives them free rein to then really think, well, what have I noticed? How does it make me feel? And that is really important as another step towards behaviour change. Lastly, we've got D in blend, which is desire. This is the same sort of thing as listening, but this time you really need to help your patient desire change, or at least bring out the desire that they already have for change. You're priming them, so basically the reason there's a bunch of flowers on this slide is because I like to think of it as being like the habit garden. And what you're doing is you're listening to their words, and then when you hear little things that they're saying that help them want to motivate themselves to change, you're picking them out, and then you're going to repeat them back to them as a gift, a bunch of flowers in that habit garden, to show them, actually, these are all the things you said that you wanted to do, and these are all the things that you'll be able to look forward to when you have made that change. And it really does help to reinforce the idea that they're going to move from contemplation into action. And when we're talking about desire, it's important obviously for the patient to have a desire for change, but it's also quite important for you to have a desire to help. That doesn't mean that you should force the idea of them changing on them, but actually just find something that you genuinely like about them so that you feel more inclined to want to help. And give a compliment if you can, and if it's genuine. So for example, if they have made some changes, tell them, say, oh, I noticed that you told me that you'd started cooking and that you tried this recipe or that thing. It's really good. Sometimes it's quite challenging to try new things, or whatever it is, if you know the person, that will actually encourage them with that positive behavioural change. So with blend, you have really primed your patient to be ready for the next steps of change. And that's where we get to it, information and timed. So when your patient is ready, it's time to look at which intervention most suits them. Don't bombard them with everything. Much as I've done in this presentation, you might want to literally reel off every single benefit that you can think of lifestyle interventions and name every single one so that they do them all. But I would encourage you to just think of one thing that you think is most relevant to them on that day, especially if you're able to see them again. The reason is behavioural researchers like BJ Fogg at Stanford University tell us that in order for behaviour change to be long-lasting, it has to be easy, it has to, for the most part, fit well into their life, and it has to make them feel like they are proud of themselves, like they've done something good. And if you're trying to do too much at once, you can feel overwhelmed, you can give up, and then it really defeats you for the next steps. So if you think that they're open to the nutritional message, then you can encourage them to look at specific food guidance if you think that's what they want. So ask them specifically, what kind of information are you after? And they might say, well, I'd like to know some basic guidelines on how I should eat well, in which case you could direct them to the Canadian Food Guidelines on the left, the Eat Well Guide, which is the evidence-based food guide here in the UK, on the right, or, even more excitingly, the Plant-Based Health Professionals Eat Well Guide, which was a meticulously put together alternative to the Eat Well Guide, which is clearly sustainable and more relevant for people who want to go vegan as well. So you can point them towards that. If they prefer internet resources, you can find something that suits them, something that suits their personality. Whether it's Game Changers, Forks Over Knives, Deliciously Ella, there are so many free resources and recipes that they can look at. You can ask them, do you prefer books? If you've got somebody sporty, they could go for one of these sporty books. These are all people who have helped athletes to thrive or have thrived themselves by eating a whole foods plant-based diet. Now, I found a lot in my practice that it helps to show people pictures of yummy food. Now, these are actually photographs of my food, believe it or not. These are recipes from my book, and I'm not a great food photographer. I just have an iPhone, so I don't take these kinds of pictures at home. But thankfully, I had a photographer and he took some fab pictures. And yeah, so if you want to share those with your patients to encourage them to try plant-based foods, then you can, and they would be available in my book. This is a photograph I did take. This is some morning pancakes, but it's just to show you that You can help people have delicious treat breakfasts that are also nutritious, and that it's really straightforward. So they can start to think about how they might implement this in their own lives. This is just a simple mixture of oats, a bit of nut milk, a banana, some baking powder and cinnamon. Blend it all together and you've got a pancake mixture. So it can be really straightforward if you know how. Giving them simple swaps is great. I love the concept of simple swaps because it helps people imagine what their plate could look like. So rather than saying fruits, vegetables, grains and legumes, they'll think, what does that mean? Whereas you could say to them, well, how about a bit of avocado on toast with some tomatoes? If they like a sort of a minced chili, you could suggest that they have a sort of 3-bean chili. If they like a chicken curry, you can suggest a chickpea curry. And so it's a way of helping them to visualize what their plate could look like. And the same with things like snacks as well. Now, again, physical activity, there is a lot of great research on that. If you think that your patient needs to actually focus on their physical activity side of things, I really like this book. It's Dr. Rangan Chatterjee's Feel Better in 5, and it's a way of implementing behaviour change in life as quickly and easily as you can. Whether it's simple resistance training with baked beans cans, or whether, out of lockdown you want to do more in the way of things like team sports, ask your patient what they think they can do, and then they can come up with suggestions that fit with what they can fit into their life, rather than telling them to go to the gym or do things that perhaps may not fit into their life. I do want to touch on mindfulness. I think it's important. It's about really activating the parasympathetic nervous system, the rest and renew nervous system, so that we can have optimal functioning of our immune system, our sleep patterns, and all of our hormonal regulation. It is important. Now, in terms of the scientific evidence for this, it's quite mixed as far as I can tell. I did find this study, which was a systematic review and meta-analysis of the benefits of meditation programs for psychological well-being and stress. And what this analysis found was that meditation did give moderate benefits for things like anxiety and depression and pain, but didn't necessarily have benefits for things like sleep patterns, weight loss, general sort of stress, and things like and gaining attention at work and things like that. So it's not a panacea by any means, but it may well help. And if it's something that your patient is receptive to and thinks that they can do in their life, then all the better. That can be the focus of that consultation. I think that there are also a lot of evidence of benefit now of breathing. Again, it's about activating that parasympathetic nervous system, and harnessing the breath is completely free. A lot of the time, lifestyle medicine can get criticised because it seems too difficult or too elitist or too expensive, but plant-based nutrition is one of the cheapest things that you can do, because everybody can hopefully, for the most part, afford things like beans and rice and lentils. Learning to cook them is another issue, a societal issue, but anyway, we can come back to that perhaps in the questions. But breathing is completely free. And if you know how to breathe effectively, it can reduce stress massively in the moment. And it's a simple piece of advice that anyone can apply. And you don't have to be too prescriptive about how they do it. So just remember, it's good for the parasympathetic nervous system. Focusing on the breath is quick and easy and completely free. You can tell them to do box breathing. You can tell them to do 4-5-6 breathing, which would be 4 in, 5 hold, 6 out on rotation. Box breathing would be out for 4, hold for 4, in for 4, hold for 4, and so on, in a box shape that you can imagine and count. Apps, stress relieving apps like Insight Timer, Calm, really can be super helpful for people. Kids. A lot of children I've been seeing recently with anxiety since the pandemic. The anxiety blast off is a lovely little technique that kids can enjoy. And all you have to do is think of 5 things that you can see, and 4 things that you can feel, 3 things that you can hear, 2 things that you can smell, and 1 thing that you can taste. It's just a nice way of engaging a child's brain and getting them out of that moment of anxiety, but it can work for anybody. Journaling and gratitude practices, again, something to perhaps study. We haven't got the remit to go into that too much now because we're nearing the end of this presentation, but they're all really helpful for engaging the emotional brain, and perhaps something that maybe you guys would want to consider if you don't and see how it feels, see how it might fit into your lives too. Sleep is really important. When we're sleep deprived, it affects our mental health, also our immune system. And I've put a few tips on this slide just to help if you want to read up on different tips on how to sleep better. But that might be your focus for your patient on that day. It may be that they're struggling to sleep, and you can give them a few techniques that will help to ease their anxiety and their sleep patterns. Lastly, I think it's really important for you and for your patients to figure out what you need. And it can be tough to know exactly what you need, but just think about when it comes to your interactions with people that you know, think about what other people do that lends to you feeling stressed or anxious or resentful, and then determine boundaries that could be in place that would make you feel better. And the same, of course, goes with your patients. Help them to figure out what makes them feel anxious and stressed, who around them contributes to that feeling and why. Help them to communicate their needs with their colleagues and friends. I've had patients extremely stressed in lockdown because they didn't communicate their need for time off when they were constantly expected to be available and on and checking emails and so on. So it's really important to set those boundaries, but also for yourself. Think about your use of devices, social media, whatever it is that you're using. They're designed to have that dopamine hit, and it's not our fault. So do think, okay, if this is causing me this low level anxiety, maybe I'll step back a bit, maybe I'll reduce my time on Instagram or Twitter or whatever it is that you use. Just take a moment to consider if that's something that affects you, because it's guaranteed to affect your patients. Most important thing is to take care of yourself. This is a hard time. Many people are suffering, and I think it's important to really address that and think, actually, what can I do to make myself feel good right now, and therefore be a better person to help other people? So really do consider all the things that I've talked about today for yourself as well as for your patients. So just in case you needed it again, here is the motivational template. Time your patients if you can. It's a bit like the SMART goals that you make for appraisals. It helps to have a specific time frame in which to make these changes. Promise yourself that tomorrow you'll do this thing or that thing, or by next week you will have done this thing or that thing. Whatever it is, ask them to think about when they think they can implement that change. It helps them to verbalize and move from contemplation to action, but it also increases their accountability because they've said it out loud to somebody who was listening. Now I'm going to use this slide to just give you a moment to think about whether there was anything in this talk that you would like to incorporate more of in your life, whether it's something nutritional, whether it's something to do with exercise, movement, sleep, stress, journaling, meditation, breath work, whatever it is. Have a think about it and see if there's anything that you would change right now, starting from perhaps tomorrow morning, that would make a difference to your well-being so that you can be the best person possible for yourself. Now, I was going to play some relaxing contemplative music to help you think about that, but I suspect that we're running quite low on time, and I'm aware that if there are questions, I won't be able to answer them if I do. So I think what I'll have to do is skip that part and just say thank you. Check out my website if you're interested to interact more. Or of course, as I said, I'm available on Instagram or email as well. So there we go, I've finished. Thank you so much for listening. I hope that was helpful. And there are references that you guys can look at, and I'm sure they'll be made available by Dr. Kassam or Rohini Bajakal after the talk. So thank you so much, everybody.
Thank you very much, Gemma. That was wonderful. A great overview of so many useful things and techniques that we can use in clinical practice. So thank you very much. So yeah, I mean, lots of wonderful comments and thanks and gratitude for that. I guess a common problem we face is the short consultation time. You know, clearly it's taken almost an hour to go through so many important points there. How do you focus in on that 10-minute conversation to really try and get the most out of your patient?
Well, for me, it's about prioritization. As I mentioned in the presentation, you're not going to be able to fix everything in one consultation. It's just, it's not realistic, but you can plant that seed, and it really depends on who they are and what they think they can achieve. So for one patient, it might be encouraging them to include a tablespoon of crushed up flax seeds in their breakfast every morning so that they can improve their blood pressure. For another patient, it might be leaving kettlebell weights in their kitchen so that they can do them whilst they're having a cup of tea every day, rather than having to go out and do a big workout. So it depends. It really depends on the person. But I would say don't get discouraged by the lack of time, because actually all it could take is one comment at the right time by the right person to flip something for that person and make them create the change for themselves, because it's not you creating change for them. That's the blessing of the fact that they've got the autonomy to change. It's them that creates the change, but you can be the impetus to create that. And to be honest, it's also why I wrote my book. I wanted people to be able to read about this stuff without having to explain it every time in my consultation. So they could just buy my book and then read it there.
Fantastic. And yeah, I mean, your book has got so much amazing information, but you share your own wonderful story of restoring your own health. Is that something that you share with your patients as well?
Yeah, sometimes. And obviously it depends on the person and, you know, how much time we have to chat. But if there's somebody for whom I think it would resonate, then I will share it, because it would then helps them with their behavior change. So yeah, I would definitely share it sometimes, not with everybody, but certainly if there's somebody there who's really desperate to bring down their cholesterol, and they think that they've tried everything and they don't want to increase their statins any further, then it's a lovely opportunity to share the fact that they can have some autonomy and they can do something different if they're interested. And you know, when they've got the interest there, you just go for it and share what they ask you to share. But you always have to ask permission. I think sometimes you can get so enthusiastic that you want to just tell everybody all the time, and they may not be ready. So you have to make sure that they're ready, and these techniques will help to prime them to be ready for the time at which you are ready, you know, to share it with them.
Yeah, and that is the challenge, isn't it? Knowing where your patient is in that journey, and it's so different from for everyone, and it's being attuned to those signals that I think really does take a lifetime of skills and acquiring those skills as a doctor. But as you mentioned, we've been through, you know, obviously we're still going through, lockdown number 3. And, you know, clearly one of the really important pillars of lifestyle medicine is fostering those social connections and those positive relationships. How have you found that impacting your patients, and how you address those issues?
It has affected it quite a lot. You know, I have come to the realization over the last few months that it's so much harder with the telephone consult. You know, I talked in the presentation about the eye contact, that face-to-face communication, the importance of touch. We know that touch is important for well-being, for human well-being. And, you know, little gestures like touching my patient on the arm, which I obviously can't do at the moment. So I do think that it has impacted the efficacy of the message, but it hasn't got rid of it completely. And the beauty of learning these kinds of tools and techniques is that they are still applicable in a telephone consultation setting or a video consultation setting. And in fact, some of the time, like in 1 or 2 of the patients that I can think back on, the powerful behavior changes took place after telephone consultations rather than being face-to-face. So don't think that it's not possible. It most certainly is. And I hope that it will still encourage you to give it a try.
Yeah, thank you. Yeah, I know that we have to use all those tools now, that, you know, getting used to using telephone communication, and it's difficult to get the feedback from our patients for sure. Well, thank you, Gemma. We are a little short of time. I do want to just launch a poll while I'm closing up this webinar. So please, can everyone in the audience fill out the poll that's coming forward on your screen now. But Gemma, thank you so much. It's always such a pleasure to listen to you and your experience. And as you say now, you don't need to keep repeating yourself. You have the book that's available to us all, and it really is wonderful. So thank you. And for those of you who are listening in and may not have come across us before, we are a membership organisation open to everybody, including students who, you know, are our future and are going to be driving the change in the NHS. So please join us, join our conversations, and continue your journey into helping your patients regain your health. And we will see you very soon for our very next webinar. So check out the website for the details. So thanks very much, Gemma, and really good luck with the rest of your book launch.
Thank you so much, Serena. Thank you everybody for tuning in. It's been a real pleasure to be with you tonight.
Okay, take care everyone.
Bye.